on TV, however you see it, it is so worth it. It's not just about the boxing, because it's a layered kind of a story, and it talks about life and letting go. I'll tell you that, it's about letting go. Sometimes we're carrying a lot of things that we need to release. And you know, I believe most of the time when people want to talk about health, they're talking about, you know, am I strong? Is my heart functioning okay? But that's just a small part of it. Overall, it's a state of well-being. So you can be physically fit and mentally poor. Your mentality is so warped. Or you could be the most spiritual person, thank you Jesus, amen, hallelujah, and you ignore this body temple. Your heart's a hot mess, your blood pressure's high, you know, you got the diabetes out of control, but you're in church testifying every Sunday. How are you going to testify? And you can't do your altar call. Okay? And that's because we've done in many ways, what I want to break is the cycle of the division that exists with the spirit and the body. There should not be a division in the spirit and the body. We are not our bodies, but our body houses our spirit. And so we cannot ignore this, what I call the body temple, and focus on our spirituality, but then we eat poorly, we don't exercise, we don't take care of the temple itself. You know, and there's many of scripture reference to that. And so, but then you say, social also matters. So you're doing your spiritual work, you're taking care of your physical body, but you don't want to deal with nobody. I don't want to talk to nobody, I don't want to engage with nobody, I don't like people. I don't like people, you know. And we, by nature, are social beings. Of course, as humans, we will hurt one another. Of course, we'll you know, get pissed off with somebody. Somebody will say something you don't like. But we can't amputate ourselves because we had a disagreement. We got a hurt. We got a pain. We got an injury. Right? Because this is all of you. So if you try to function with one part of you broken or missing, it's going to affect the whole being. And then we have the mind. And if you know anybody who has dementia or is slowly losing their memories, you will see the impact it has on the whole body. Because when someone starts forgetting, they won't eat. And if you forget to eat, you end up destroying the body. They forget the people in their lives. And so their engagement with their family members starts to diminish. So and this is not my talk today, remember that you are mind, body, social, and spirit. And feed every single area. You know, it's like those bodybuilders, they work on the upper body. See those guys, they're big, they're smooth. You know, they get all swole, but then they got the little pencil legs. Yes. So they neglect the other part of their body. And people do that. Why do you think people do that? Why do people may emphasize, I'm going to church Sunday, or they go to the gym all the time? Why do you think they may neglect social or engagement? Why do you think? Why would you just ignore that part? We said hurt, right? Pain. What else?
Overcompensate.
Overcompensation. What else? Why would you just not bother, you know, going to exercise? Laziness? Where does that come from? Why would that come from?
Not depressed, or you just don't feel like it. You just, your mindset.
Mindset?
Yeah.
You're only focused on one particular thing.
Okay, so it's about focus, right? But the question is, why are we losing focus on the whole being Why do we just say, okay, I'm just gonna work out?
Some people don't realize that they all work together. Yeah, they just say, I wanna look good, people look at me because I look good, but then your mind is messed up, when they talk to you, you're like, ooh. But
Yeah.
You're just not a
People person? Pain. Pain. And pain comes in many ways. Pain. And that's the talk today. We're gonna talk about pain. Anybody, I'm gonna ask you with the sounds of phones, so you get it. Anybody in here ever had pain?
Yes.
Pain.
Yes.
Okay, yeah, all right. What type of pain? Where was it? Where's your pain? Where was it? Back, shoulder, knee? The knees?
Mine was when the loss of my husband.
Okay.
The loss of my husband.
So someone talked about pain in your body,
An emotional pain.
but we had another young lady here who said she lost her husband. So that was a pain. But did it show up on your face? How did it show up?
It didn't show up on my face. I just withdrew. I just
Withdraw.
withdrew.
So you withdraw. And you get pain in your body. What did you do? When you had that pain, what happened? What did you do?
You take some medicine, you grab some medicine.
It's the same thing happens.
Get some painting and rub the paint.
So you could treat it, but most people, when they have pain, they pull back. Pain makes people shut down. So if your leg is hurting, your back hurting, someone says, hey girl, you wanna go shopping?
oh, my knees, y'all, I can walk along.
My knees hurt, I'm not going shopping. I say, oh, the team, we're gonna go to the gardens to go look at the new orchids. You wanna go? I ain't going. Or as you said, you've lost your husband, someone says, hey look, they're gonna be, we're gonna have a ball, there's gonna be a ball, you wanna go?
No.
I'm not going, I ain't got no man, I'm not going. And so you withdraw. And the problem with withdrawing into yourself, what happened when you withdrew? What did happen to you?
I got depressed. I got fat. I didn't want any outside contact.
And when you're physically in pain, what happens? Isn't it the same? Don't you get depressed too?
Yeah.
And oftentimes people think that just because you have a physical pain, you don't get depressed.
No.
But you do. You do. And it comes from a loss. And it's called a loss of function. If you're used to doing something all the time, get up and go. I remember when I had my breast surgery and they took off both breasts, and I told you, it didn't occur to me. I get to chemo, radiation, and it didn't bother me until I couldn't zip up my shirt.
Oh, yes.
And I just bawled. I was just bawling because I could not zip up my zipper. And for the first time in a year and a half of treatment, I felt depressed. And I didn't want to do anything because I could not move. Anybody ever felt like that? When you lost something, your knees all of a sudden started really acting. I don't want to go nowhere. I don't want to do anything. You lose a mother or father, sister, brother, spouse, and like, leave me alone. I don't want to do anything. And it's a physical pain.
And you are not over 65.
No, but I will be. will be. And pain has no age. There is no age on pain. There is no age on pain. Which brings us back to what we tell kids. What we say kids, they fall down. What
Keep
you tell-
living. No.
What you crying for? Get yourself up. Stop that pride. What y'all crying for? I'm in pain.
Yeah.
It hurts.
Suck it up.
Suck it up. And that's the worst thing advice we can give people, is to not understand and accept your pain. Because if you suck it up and keep it moving, you sometimes ignore it. There's a time and place for everything. You need to be in the pain, not stay in the pain. Just long enough to recognize what is going on, enough time to mourn, enough time to realize that something has to be done, enough time to come up with some answers to move out of the pain, right? But to tell a child or not, suck it up, get over it, okay? It's to tell them not to be in tune with their bodies, not to be in tune with their minds, not to be in tune with their feelings. And we've done a disservice when we tell people, get over it. You know? My partner just died. All right, you knew he was dying. He was already, in the hospital, God knows how long. No. You still have to work through it. And you give people permission for their pain. What we don't do, and we should not do, is what? Stay in the pain.
There you go.
You don't stay in it. So yes, you need a period of time to be in it. Understand it. Then you gotta treat it. Because it becomes paralysis.
Mm-hmm.
Anybody can speak to that?
Yes.
Anybody? Tell me. If you wanna share.
Okay, the way that I do that, in order to get my minds, first of all, out of it, when I walk in front of my mirror and I look at myself, I'm just gonna give an example with my arm. I said, Lord, I'm gonna raise my arm and, worship you and adore, everything. I said, I talk to myself in front of the mirror. I'm looking at myself. I said, I wasn't born like this. That's not the will of God. Get out of my way. I speak to it.
And you use it. And she's using what we call affirmations.
Yeah.
So have your pain, but we want to use, and that's a great segue, we want to affirm, and what you affirm, which only means to speak what you want.
That's so funny, cause I get up and sometimes I say, come on, Jesus, come on, we got some work to do today. Come on, drop the knees or whatever it is.
Has anyone ever done it and it helped? Did it help?
Yes.
Because I don't want to tell you stuff that don't work. I mean, I need some people to talk to me. Does it help to talk to yourself?
Yes. I don't know if I was talking to yourself. I think the Lord was talking to me, because when I first lost my husband, every night
Yes.
for 2 weeks, before I went to bed, I said, Lord, take me tonight. So one night, I was in the room and I was saying that prayer, take me tonight. And just like they said, something grabbed me and said, stop it, I'm not ready for you, stop it. When I'm ready for you, you'll know it. And I went to beating in the bed. Well, Lord, you said, and I was, that cry, that hysterical cry, and I'm beating in the bed. I said, Lord, you need to comfort me. I said, because you said in your word that blessed are that morning, they should be comforted. You need to comfort me right now, Lord. And all of a sudden, peace came over me. But the peace came, and there was no remembrance of my husband. I said, oh Lord, forgive me, Jesus. I said, I want your comfort, but I don't want to forget my husband. So then all of a sudden the memories and stuff and I laid down and went to sleep, and I never prayed that prayer again. I never prayed that prayer again.
So she took it through, you be in your pain, recognize the pain, but we gotta move towards treatment from our pain. So what do? All right, so one solution we gave was do some affirmations, but you can't affirm what you don't know, okay? Oftentimes we be guessing this stuff, my shoulder hurt, then you ask a friend, what you did for your shoulder pain? Oh, okay, you put some ice on, okay, what you did for your knee pain? And we Googled, Dr. Google, knee hurts, what should I do? And that might be helpful, but it also may be damaging. You're walking around putting the heating pad on your skin. Next thing you know, you come in my office, I done burnt off the skin off my knee because you put on the heating pad too long. So you affirm in looking for solutions. But the most important thing is, you have to be specific. Okay? You have to be specific. I just want to be happy. I just want to be well. What is that? What is that? You know? I just don't want to be in pain. Pain where? Your knee, your head, your heart? Where do you want it? The mouth has naming power, and you have to speak what you want, but you gotta be specific. And that's where choosing the right physician for the right condition works. You don't go to the spinal specialist when your knees are hurting, and you don't go to, the dermatologist when you have the arthritis. That's similar to looking to your friends, and I love that we communicate, but you have to get the right advice. Yes.
That's what they say, if you pray for a man, better be specific.
Be specific, or you will get a man. He said, I just want a man. Now, did you want one that got a job? Know how to fix something? Goes to church with you? Don't steal from you? Funny? Happy? You can have a man and he ain't happy. And take your happiness and make you sad. Be specific. We're going to do Sex 101 in April. But keep that in mind, that you must be specific with your pain.
I said, and they're lying to you. They said they are single and they're not.
Woo, child, they need to go to jail for that.
That's going to be our class.
That's doing a lot of people. They need to go to jail
So
for
we're
that.
gonna affirm what we want, but we have to be very specific about what we want, right? So this comes down to, so you go to the doctor, just a little piece of advice. And you say, Doc, my knees are hurting, right? And they give you a prescription.
I don't like that.
Okay. The first question you must ask, don't leave that room without asking the question. What is this for? And they said, well, that's for pain. What is it supposed to do? Because there's a lot of treatments for pain. Is it going to reduce the inflammation? Or is it just going to attack the pain synapses? Is it just going to shut down the message? Because most pain comes from inflammation. Okay? And you can cut down the signal to the brain that says pain, but the inflammation is still there. So it's not real. So then you ask yourself, is this medicine going to help inflammation? And what am I doing to cause the inflammation? Back to the knee. If your knee swells up and you put the ice on it, and the ice brings down the swelling, but the reason your knee had swollen up was because you tore the ligaments in the knee. When you start walking on it again or doing stuff, what do you think is going to happen? It's going to swell right back up.
Too much pressure on it.
Yeah, you're putting some pressures, but there's still a tear. So you have to find out what is really the true problem. And oftentimes we don't want to know what the pain comes from. 50, 60, 70, 80 years old, and you got pain in your soul. And you're miserable, you may be unhappy, you're snappy, you don't want to go anywhere, you're just negative.
Complaining all the time.
Complaining all the time because you're in pain. But you won't find out what the pain is. Maybe you never forgave your mother for abandoning you. Maybe you never knew who your daddy was. Or you were abused as a child. Or you were with a partner that was abusive to you, or didn't live up to the expectation that you had. And it may be time to forgive. It may be time to forgive so you can get out of pain. But you can't forgive that which you won't recognize. You won't recognize it. You don't want to look at it. You don't want to find out what's going on. And so you stay in the depression and the feeling of loss and isolation. Yes.
If the doctor told you that you have a tear in the ligament.
Shoulder of the
Yes. And telling you that they don't recommend surgery.
right.
What, ask him what are the cause, pain medication.
No.
I didn't take the medication.
Okay. So the question is, if you have a tear, in her case, she had a torn, maybe a rotator or cuff.
Yes.
There are many ways to treat a tear, right? Know that the body heals itself.
Definitely.
Everything that you do to this body, for the most part, it's gonna figure out a way to get you out of discomfort or what have you. So when you make a tear or break a leg or injure a part of your body, the body's going to try and do some healing work on its own. The only problem with that, sometimes the body doesn't get it right. So because you may have, I see with hands a lot, a break or fracture.
Dislocation.
Yeah, you're dislocated, you don't get it set correctly, you don't do anything, you didn't go to the orthopedist, and you just, wrapped it up, don't use it, and the next thing you know, 10 years fast forward and your arm's like this.
Yeah. Yes.
The body healed it. It healed the injury,
They want to break it.
but that's a problem because it healed in a way that makes it non-functional. So in answer to your question, 1, do nothing is always an answer because the body will eventually fix it. 2, actually do surgery immediately. 3, you can give pain relief, ice, heat, and steroids, but that's only for the inflammation. That's not for the healing. Yes.
But what the doctor told me.
And therapy.
And sometimes I don't do it. Don't lift a certain amount of.
Wait.
And sometimes.
And sometimes she ignores it.
No, it's not a matter of ignore. But sometimes you don't have nobody to do it at that specific time, you have to do it.
No, don't do it.
For my
Don't do
rotation.
it. Don't do it. Seriously, don't do it. Or lighten the load. Lighten the load. If there's something that has to be moved, and this is just an aside. You're right. Some things do need to move, right? I once was rearranging my house, the furniture in my house, and I was moving a dresser, and it was pretty heavy. Empty the drawers.
Take the drawers out.
I took out the drawers. I tried. And I just couldn't do it. So I said, girl, use your brain. I emptied the drawers.
That's it.
And then when I emptied the drawers, it was still too heavy.
Yeah.
So then I did what? I took out the drawers. And it took me a little longer, but you figure it out how to get it moved without hurting yourself. Okay? Back to pain. I want you guys to get the pattern. 1, know that you're in pain. Know that the consequences of being in pain will lead to isolation, withdrawal, depression, which you can do for a short time, but doing it for a long time is not good for you because it affects the whole body. So, give yourself a time. I'm gonna be in my feelings about the situation for about 1 month. I'm gonna be mad for about 1 month. That's how long I'm gonna be mad. I'm gonna give myself 1 month of madness. And then when that month is up, move to solution. I forgive, I release, I let go. And even though you may not believe it, you keep affirming it. And you pray on it because you need the Spirit to come and assist you with it. And you work it, and you affirm it, and you speak it, and be specific about it. I'm not going to forget, probably, but I will release myself through forgiveness so that I can move on to living again.
Exactly.
Okay? I'm not going to forget my husband. I'm not going to forget him. I don't want to forget him. We had a wonderful time together. But I am going to release the unforgiveness of the loss so that I can thrive and move forward. You see? Give yourself a time. You may need to give yourself a year. You may have to give yourself 2 years. Hopefully you don't, for whatever the thing is. Your knees. You say, okay, I'm going to try and fix my knee problem myself for 4 weeks. I'm gonna put my ice, I'm gonna put my heat. My sister told me to wrap a leaf, some olive oil on it, to put some virgin vinegar on it. You know, I'm gonna do that for 6 weeks. Look, after 6 weeks, the vinegar and the olive oil is not working. We gotta move to another solution. Okay? We gotta move to another solution. Making sense? Yeah.
Going back to the pain that you mentioned earlier, sometimes it's always good to ask the doctor what is the side effect.
Oh,
Because some, you may be taking other prescriptions and that doesn't correspond with the one that you just gave you.
okay.
Am I right or wrong?
You're right, I've been there.
Yeah, but that's why
Okay.
when you go to the
So,
doctor, they ask you
question.
so they know.
All right, as an aside, the question is about meds. If you're taking it or given a medication for your pain,
Contradiction.
right? Medications, and not just medications. People, there's a trend that people are like, I don't wanna take meds, okay? Medications are not the only thing that have side effects,
Right.
okay? And everything, what you're looking for is not a side effect, you're looking for an adverse side effect. One that you can't tolerate. Okay? So an adverse side effect. Doc, what are some of the adverse side effects? And the key word you have to know about medications is may. May have. Just because a medication has a side effects, you may not get that. You just need to be aware that it may happen, so that if it does happen, you know what to do, right? So first, what is this medicine for? Second, what are the possible side effects, adverse side effects, right? That may happen. And then you get to weigh. And what you're talking about, is there any interactions with any of the other medications I'm taking? For instance, back to the knee. You injure your knee, you've been putting the ice, the heat, it's not working. After 6 weeks, the tea leaves haven't worked, so now you're going to the doctor and they say, oh, look, you have a sprain. I'm going to recommend what we call a non-steroidal, an anti-inflammatory, ibuprofen, naproxen, Aleve, right? And you say, well, that's for? Well, it's going to reduce the inflammation. And when the inflammation goes down, it gives the body time to heal, right? And then you're going to do some physical therapy. But then you have to ask the next question, hey, doc, I'm on all these other medications. Is it okay for me to take the Aleve, the naproxen with this other medicine? Now, if you're taking aspirin, you may not want to take an Aleve because you may get a bleed in your stomach. And if you really need it, they may recommend you take like a Pepcid and antacid with it so that it doesn't affect your stomach. Or they may say, stop taking the aspirin for a couple of days. Very important. What's the interaction? Will it interfere with another medication? Okay, good question, good question. Good. Question on pain. All right, how many, and you don't have to let other people know, how many people here know that they have some forgiveness work to do? That they holding on to something? That they holding on to something that somebody did to them when they were like 25 years old, you know? Okay, now just think about it for a minute. That unforgiveness that you're holding on to, right now, if you can feel it in your body, where are you feeling it? Where do you feel it? If you can think of whoever it is or whatever it is, where are you feeling it?
Inside of you.
Is it in your head?
In my
your
fist.
In your fist? In your heart? Can you feel it in your chest? How about your stomach? Do you feel it in your stomach? Okay. What I'm asking you to do, think about this. You have something mental, emotional, but you're feeling it physically inside your body. You feel it in your head. You feel it in your stomach. You feel it in your fist. How how can we separate ourselves? So you had an emotional problem, but you are holding on to it, and it affects your stomach, it affects your mind, it affects your sleep, except your ability to engage with other people, because they may turn out to be like that other person.
I'm not gonna make it effective like that.
And you have to think that you can't just think you holding on to something and it doesn't affect your body. You know, you say, how could that I talk about this? Because I'm about healing and health and wellness, and you can't be whole and complete and well if you have pain, and the pain is coming from an unforgiving heart. So I'm not telling you when to do it, but I will recommend take some time to really look at it. Get the treatment plan for it. It might be writing it down, writing a letter, maybe seeing a therapist about it. It may require seeing a minister about it. It may require, and if they may have passed, the person may have passed, they may be gone.
You still mad.
You still can have the conversation because we're spirit. You can take some time, go to the beach and sit down and have that come to Jesus moment with them. And say, I need to talk to you. And have that conversation. So that you can be released of the pain. Pain destroys and causes injuries. You know? And guess what? Not to the person. To you. They can't even remember what they did. Yes, ma'am.
I had a problem like that a couple years ago with my two sisters,
Uh-huh.
we done talked for a long time. And after a while, I started thinking about it. I use a couple of nasty words, I ain't got time for this mother, so-and-so. And I got it before, and I called, I said, listen, I don't have time for this so-and-so. We gotta come together and talk.
Amen.
So no, we talking, we call, we go visit, but we done talked like over 20 years, something like that.
Ooh,
We done
child.
Just saying
Look at
that.
that, 20 years.
Stupid thing happened, you know.
20
I started
years.
thinking like, I said, I ain't got time for this. And I called him, I said, look, we gotta come together, we gotta talk. I do some nasty
You kept it
words.
100.
But no, we lost our talking, we called.
Now,
So let it go.
and you released it. And guess what? I had this conversation before, and someone said, well, why should I? Why should I be the one?
I didn't do it.
It was my fault. I didn't do it. I wasn't the one. Why should I? And what's the answer?
Because it's affecting you.
It's affecting you, it's not.
It affects you. It's not that you're bigger. Actually, I'm not. I'm still holding a grudge. No, I'm not that big. But I'm the one affected. I'm the one affected.
Is it like stress and anxiety? Like you can't see it, but it's still like
Still
gonna
present.
do something to you.
Yes. So we started off because I wanted you to see that you are a fourfold being. You're physical, you're mental, you're social, and you're spiritual. And if you are holding on to something, just as the young lady here who lost her husband, she stopped engaging with people. Or if you're having pain in your joints, you don't go places. But you also, if you feel someone has wronged you, you build a mistrust for people, and so you think twice about doing stuff with people. You know, I don't know. And so it creates barriers. And when we have barriers, we can't have progress. You know? And it's just the beginning. I think that was wonderful. And I know it was brave. Even though you were saying, I'm done with it, it took a lot of courage. And sometimes when you don't have it, just pray for it, ask for it.
What if you're a child and you feel like that about your parent? Because some parents feel if you say certain things, it's rude, even though it's the truth and it's how you feel. Or if they hurt you in some type of way, for you to go speak to them. Some parents, you can't even bring up that they did something wrong.
That's true.
I did the best I could,
Yeah.
but still,
They won't hear it.
the conversation.
And that's a good point. What if the person doesn't want to have the conversation? Again, the conversation and the forgiveness really has nothing to do with the person. They don't have to be okay with the conversation. In fact, they don't even have to be present for the conversation. You can have the conversation alone.
Anywhere.
Anywhere. Take you to the beach, take you to the park. Look, Mom, I am so through with how you treated me as a child. You abandoned me, you left me, and I'll take care of you till you die. But I just want to let you know how you treated me was wrong. And yeah, you did the best you can, but it was still wrong. And you can have that conversation in your room,
Even in the bathroom.
in the bathroom, at the park, at the beach.
Yep.
And it's about you letting it go.
And a lot of times, it happens funeral time. The
Oh,
person is
yeah.
already dead, and
Can't
you
do nothing
still
about it.
in fight with yourself, with the person, family, especially relatives, you know.
And here's the part two of that. After you state it and release it, whether you get the chance to have it with the person or not, especially if they're not there, you gotta move to the next part.
Exactly.
After you speak and identify the problem, you now say, I release and I let this go.
Let it go.
It will no longer imprison me, hold me, keep me, bind me,
Yeah.
and separate me from my good. Yes.
Is that why people at funerals go crazy and be jumping and all kind of stuff?
On things
It's
that
like
they
they
so-
still dealing with things.
Yeah. So can anybody do this homework? Can anybody go home and just do a little meditation on anything you might be holding? I'm gonna do a test in 1 month.
I am not,
In 1 month.
because I think forgiveness is not about the person. It's
No.
between you and your spiritual being.
Yes.
And when I do that, I ask the Lord, if I still want you in my life, I will let him leave you. If I don't want you, I said, keep them away out of my path,
Yes.
because I don't want you to do it again. So stay away.
And
But
then,
it's not about the person, it's between you and God. If you have a personal relationship, not just going to church and talk. You have to have a relationship with the spiritual being. That's when you talk to that person who you think is a higher power. They help you to release.
release. Yes.
You know, I'm reading this book, 100 Days of Real Motivation,
Yeah.
and it's weird because today, day 59, it's titled Exercise. It says humans are multidimensional and require physical, mental, and spiritual stimulation and muscle that is not used to become weak and dormant. The more you exercise in physically, mentally, and spiritually, the clearer your mind, the healthier your body will be, and the more productive and energetic you become.
Yes. And so the homework I was giving you is just for the next month, try and find all the areas that you're holding pain. And try and do the forgiveness work and letting go. And in 30 days, check out your body and see how your body feels. See how the physical body feels in 30 days.
That's the biggest medication.
See how your
Let go.
body feels in 30
Let live.
days. After you let go of all whatever's hurting, yes.
What if you don't want to let go?
Why would
That's a
you
good
keep
place to
it?
be. That is a great
And
place to
I'm
be.
gonna say, I lost my husband, it hasn't been 2 years. And I enjoy, not enjoy, but my moments by myself when I'm with him and I'm feeling him. If you can understand what I'm saying.
I do
Because when
understand.
I'm around people, I'm a people person. But I like that time with feeling him involved in what we were.
So you are holding on. And it may not, as I started, you have to determine when you're going to do the treatment. As I say, it could be a year, 2 years, 3 years, tomorrow.
Yep.
But you gotta pick a day, pick a time.
Doesn't mean she's sad. I mean, if you're holding on to those memories and they're good memories and they keep you thankful that you had those memories, should you,
Oh,
is that affecting, I mean, are they affecting you? I mean,
She
are
said she
they
don't meet
making you
nobody. But when she has a moment where she's, I guess, meditating and being with the spirit of her husband. So she is taking time to be in communion with his spirit being. But he's passed now almost 2 years. And she's not yet ready to allow his full transition. And so, it's work. You gotta think about it. Think about when you will be ready, or plan for it. Yes.
My husband, December the 14th would be 9 years. And what happened was, one night I had a dream that he had a avalanche and I had a trailblazer. And we had to go downtown, because he was Miami Heat season ticket holder. So we had to go down there in that area, because on Fridays we had date night. So we were going to pay the bill, okay? So I went in to pay the bill and I came back out, and I was supposed to follow him to the restaurant. And he was just ducking in and out of traffic, in and out of traffic, in and out of traffic. This had been almost 3 years since it passed. And I couldn't find him. I said, okay, well, I'm gonna go home. To me, that was him telling me, okay, let me go now and start over and start a new life. And I don't forget him, but I can now go out, and I'll go out, I'll have a date, I'll go out, so.
And live. So, time. Your timing, you're an individual. You have to choose when you'll be ready. But the first thing is recognize that you are holding a pain, and holding the pain affects the whole body. So, yes.
Why do men not say nothing about this pain thing?
So pain don't affect me the way it
That's
affects
why I'm
women.
saying what I'm saying.
I'm listening to all
denial.
this. We don't hold on to pain. We don't hold on.
What do you do with your pain? Share. What do you do when you have pain?
Well, last time I had a situation where me and my friend had an argument,
Right.
and I didn't agree with it. So when we separate for about a day and a half, and he decided to come over
Right.
and invite me to go play ball, that was his way of coming back friends.
Right.
And I decided to go
Okay.
and forget about that pain or the anger.
So you
That
forgave him.
easy.
It was that easy. I didn't hold on to it like my sister and them hold on to pain. They hold on to pain.
But you forgave and you moved on.
Right, because we were real close, but just that moment I was angry at a high level because of the situation. And he decided to say, okay, enough is enough. And he came over and made that.
I won't say
First
men,
acknowledgement.
because I do know some men who are still holding on to stuff for years.
But most of us,
Don't do that.
it don't do that. It's more quicker to forgive and forget and just move on, especially if you were close.
It takes practice. You literally have, it's a art that you have to do. Practice in forgiveness. It's a practice. And the more you practice it, the quicker it gets. The quicker it gets. Yes, mother.
Now, like we women, like men, they run around, they mistreat you, they do all this stuff.
Hold up. Now we're going to a whole new ball game. I mean,
And it's weird. And we women, because we just want to forgive, because we want our families or whatever. But as soon as a woman, a lot of men, they can't. They find out you run out on them. They forget about all that you cook and clean and take care of children. But when they find out that you ran out on them, it's like, no.
They can't forgive.
What's that forgive? What's happening there? What's happening there?
So, good question. So,
the
the question,
situation,
You can step out as much as you wanna, but when the woman do it, then y'all can't give the woman. Woman doesn't forgive all
how women
those.
can forgive infidelity? The question is, let's break it out.
okay.
Women can forgive infidelity, she's saying, quicker than men. Men actually most likely won't forgive infidelity and will leave you on it. Whereas a woman will more likely forgive you and give you multiple chances.
Yes.
And so our question is why? Why men won't forgive infidelity? Yes.
Because you don't you cabbage twice.
True, very true.
Translate. He said something about cabbage chewing it twice.
Right, she left the relationship, that's it.
No.
Okay, but she said that men do it all the time and women forgive.
No.